Okay, folks, it's a different type of dentistry, and we're talking biological dentistry with Dr. Sam Glick. And Dr. Glick, I've been waiting for this segment for 2 days. I knew you were coming. So what is biological dentistry?
Yeah, thanks for having me here.
It's great to have you.
Yeah, shout out to my family, my little kiddos, and my wife at home.
There you go.
Sloan and Silas, hi. But biological dentistry is a holistic approach to oral health that considers how dental treatment affects systemic health, affects the entire body. So in my offices, we try to take care of our patients, not just focusing on the oral cavity, but how it can affect the rest of their health in the long term.
Okay, so your practice, you have 4 locations?
Yeah, 4 locations located in Aurora, Cuyahoga Falls, Oakwood, Bedford area, and then Westlake as well. So keeps me busy.
I see a lot of different commercials for dentistry, and some of them are talking about complete renovation, some partial renovation, prevention. Where does it start with you, and what's most important in your practice?
Yeah, absolutely. We do pretty much everything in-house in our dental practices, from full mouth rehabilitation with extractions and dental implants to the basics, you know, your cleanings and keeping teeth healthy. One thing that I always tell patients and recommend as it relates to biological dentistry is removing their old silver amalgam fillings, getting the mercury out of their body. So from simple to as extreme as it gets, we do everything for our patients.
How big a deal is that? I mean, you're talking about patients that would have those old kind of fillings would be what, like 50 plus, 40 plus years old?
You know, unfortunately, we've even seen that military, you know, still does mercury amalgam fillings, so they can be put in more recently, and there's a lot of people that can have health effects from that, especially if they have a metal sensitivity.
What are some of the effects? Like somebody might not even notice because they've been putting up with it all these years.
Yeah, drowsiness, you know, brain fog, those things.
Oh, I got both.
Yeah, right. We all do. A little coffee helps sometimes, but no, in the long term, you don't want to have that mercury in your body for those obvious reasons. So.
I know sometimes too, like an older person like myself, I've gone through a couple dentists. You know, like you know, it's gone, you know, pass away or something, and I'm looking for a new dentist. How does somebody approach you as a new patient? What's the process?
Yeah, well, the first thing is they come in, we take dental x-rays, radiographs, we do an exam in the chair, and basically we tell them that it's a judgment-free zone. We let them know that, hey, we're here to help you, we can guide you along the way, whatever treatment is needed, we'll list everything out for you, make it simple and easy.
Yeah.
So.
Because I know a lot of times it can be a self-conscious event to go to a new dentist or to figure out what you want to do.
Yeah, it's a vulnerable position to be in as the patient.
Yeah.
So we try to make it as comfortable as possible for them.
Yeah. And I noticed too, your like health insurance, if you have health insurance, it involves some dental, but you can't always figure out what dental and how to do it. So how do you help folks go through that mess?
Well, luckily, I have an amazing team, of staff in my office that handle the insurance. So when the patient leaves the office with a treatment plan, it'll also have on there what their out-of-pocket investment is and what their insurance is estimated to cover. We do all that legwork for you so that you don't have to worry about it because, man, can insurance be confusing.
Yeah, and if somebody has like a big rehabilitation or whatever, can you help them with some kind of financing or payment plan?
Absolutely. We have many financing options and payment plans in-house as well as outside financing partners like Care Credit and Cherry where you can apply for them, and we walk you through that as well, so teach you how to sign up for it, those things.
In practicing dentistry, biological dentistry, what age should kids start going to the dentist?
Great question. We actually recommend that kids come in or parents bring the little ones in at either age 1 or their first tooth, whichever comes first.
Yeah.
That way we can catch any abnormalities, tongue ties, lip ties, little things that can happen that can affect development. And so you want to be able to intervene if there is an issue.
I think it would also help with acclimation a little bit because, you know, if you don't go to the dentist till you're 4 or 5, I mean, just from comics and jokes or whatever, going to the dentist, it's not a fun time. But
Absolutely.
But if you're used to going from the beginning.
Yeah, coming in desensitizes them a little bit. And we have, you know, young kids sit in mom's lap and, you know, keep them comfortable. But it is like the more times you do it repeatedly for a little one, it's easier for them. So.
And we use the term biological dentist. How should that make like middle-aged or older people who are looking for a new dentist feel better about coming to see you and your method of practice?
Yeah, it tells you that when we do treatment in the mouth, we're considering how it can affect you systemically, right? I don't want to put something in your mouth like a titanium dental implant if you have a metal allergy, right? There's other options we can consider. So that would just be one example. But some dentists just focus narrowly on the mouth as a isolated system, and we don't want to do that.
How would that metal allergy present itself? How would you know?
Again, drowsiness, brain fog, but also it can lead to inflammation in the body, joint issues, different pathology in the body that way.
Great. So you have 4 locations. Where are they?
We are located in Aurora, Cuyahoga Falls, Bedford, Oakwood, and Westlake. So.
You know, Dr. Glick, that's the hardest question I ever ask anyone.
Right.
Or if you ask them their phone number. So they, I can do anything in a little bit.
I can talk teeth, but I got to know where
there
my
you
office
go.
is.
And how about age span? How about for your practice? Like
We save
you said like
all
1
ages.
years old?
1 year to 100.
There you go.
Any ages and all treatment that you need, we
Well,
can
I'm
do
closer
it
to
all.
100, so maybe I'll come see you.
Hey, no, you look really good, sir.
I love you. Smile. Thank you very much.